is Colorado's own Shallow 2 Daybreak at 8.
Brand new at 8 o'clock and To Your Health. Even though all American adults are now eligible for the COVID vaccinations, the end of the pandemic seems nowhere in sight for those suffering still. They're called long haulers. They're suffering from COVID-19, even if they caught it months and months ago. We are joined this morning with CaringBridge collaborator, Dr. Archelle Georgiou. It's good to see you, doctor. So give the people at home an idea of what a long hauler is. What is a long hauler when it comes to those dealing with COVID?
People that refer to themselves as long haulers, or those who have long COVID, are those who have COVID symptoms that persist beyond 4 weeks. They can persist for 8 weeks, 12 weeks. We know somebody that has had symptoms for longer than a year. And the most common symptoms are cough, chest pain, shortness of breath, joint pain, fatigue. But there can actually be 200 different symptoms that people have, and they vary from patient to patient. In fact, in the same patient, the symptoms can vary from day to day. That's what makes this so challenging. And long COVID affects about 10% of people who have COVID-19. And it doesn't matter whether you had a mild case or a severe case of COVID, you're still at risk for long COVID. And
doctor, since COVID is so new and we're kind of just walking our way through this, we really haven't been able to study long haulers, and it sounds like it's tough to study them. Like, a lot of their symptoms could be seasonal allergies, or they could, morph into something different. So how do you guys pinpoint that these symptoms that they're dealing with are from COVID?
Well, that is what makes it very challenging, and that's why one of our strongest recommendations is, if you have symptoms of what you think could be long COVID, to make sure that you connect with your doctor and have them be able to diagnose whether it is long COVID, or maybe there's another underlying condition that needs to be addressed and treated. Keep in mind, though, at the same time, that there are many physicians who are unfamiliar with the symptoms of long COVID, or maybe brush them off as something that's insignificant. And so people need to recognize that if they're not getting the care that they need, that there are specialty clinics that have emerged. There are over 30 across the United States that are designed to just be special resources and support and medical care for people with long COVID. So it's important to make sure you get the care that you need.
And CaringBridge is helping these people. Describe a little bit about how people can log on. Maybe they can't go out, but they can log on to their computer and reach out to talk to those people who are dealing with that. Describe CaringBridge's role in that.
Absolutely. Well, for 24 plus years, CaringBridge has recognized that it is better to, if you have a health issue, that you shouldn't go through that health journey alone. And so we're building on that, recognizing that people that have long COVID shouldn't be going through that challenging time alone either. And so we've built a COVID specific resource site on caringbridge.org/COVID. And what people can do is go to that site, and they can do a number of different things. Number one is that there's the latest research on COVID and long COVID, so that people get the latest information. There are links to support groups that have formed online of patients that have long COVID, so that you can connect with other people that have this condition and share ideas about what's working, what's not working. We have a survey that we really hope that people will complete, because people that have long COVID have an opportunity to contribute to the research and maybe help other patients. So people's answers are confidential, but we'll be aggregating the results in the middle of the summer and releasing them publicly. And then you can start your own CaringBridge site, so that you can have your friends and family and those who love you in a community, a private, safe community online, so that people know what's going on with you, and so that you can reach out to them and you can tell them how to help, because they want to help. They just need to know how.
Boy, that is true. Dr. Georgiou, we appreciate what CaringBridge is doing to help those that continue to suffer with COVID. And we know that when you said 10%, the numbers will continue to grow. And reaching out, talking about what's going on is how we can get to the end of this. So we appreciate your advice and you sharing what CaringBridge is doing and how they're helping.